Assalamualaikum. Good morning, everyone. I hope you all are fine. And I wait for your feedback about these events, about these talks of mental health awareness. And I would be glad if you can share your concerns and we can further discuss them. And I hope that most of your questions are being answered without your asking. And I hope and you all are doing well and enjoying your life and understanding that mental health does matter. There needs to be awareness that needs to spread about mental health, and it is not a taboo to talk about, and you just have to overcome that shyness, and inshallah things will improve for everyone. And let's see if someone's here and then we can start the live session. And you can message in and anyone here? Okay, so we'll start our talk today. Yes, today we are going to talk about mental health issues. First, we are going to have a brief recap of mental health matters. In last discussion, we talked about the importance of mental health in our daily lives, the impact that mental health has on our physical health, and how we can improve our mental health, and most importantly, why mental health is not discussed very much. And not to forget, there is no health without mental health. And the takeaway note from the previous event: pain should not be killed by taking a painkiller. Pain should be acknowledged. It must be used as a guide towards change in order to address its root cause. So whenever you feel pain, it's not just the pain there, it is because of something. It is a reaction to an action. There is a cause. So the main point is to find that cause and cater to that cause, and not just use painkillers to cater to the pain. And before we start with mental health issues, there are some things that we need to differentiate about mental health. Mental health is overall emotional, psychological, and social well-being of a person. It is complex, as discussed before, and it is important to be dealt with issues concerning it, and this was discussed earlier as well. And then there is the term which we commonly come across, mental illness. Mental illness is a wide range of mental health conditions that affect your mood, thinking, and behavior. And it is normal. Every person once in a lifetime at least does suffer from mental illness. The mental health conditions, they impact and they are so severe that they turn into an illness. But the good thing is that they are treatable, and if, again, it's a big if they are caught at proper time and dealt with properly. Another thing that we need to differentiate is between the terms psychologist and psychiatrist. Psychologists' primary focus is on psychotherapy. Psychotherapy is also known as talk therapy. You tell them your problems and they listen to you and they suggest solutions. And their primary treatment is behavioral intervention. So they tell you what to do, how to do, in whatever their circumstances are. Psychiatrist, on the other hand, is a medical doctor. They can prescribe medication for your treatment and they diagnose your illness. And because they prescribe medication, they manage medication as course of treatment. So this is some psychologists and psychiatrists. These are two terms that most people use interchangeably, but they are not the same. So we need to be careful what we are saying and who we are going to seek help from. Okay, now main thing, causes of mental health issues. There are many. Inherited. Yes, it's kind of scary thing that if your parents or one of your parents has some issues with mental health, there is a good chance that you end up having that issue as well. But it's not necessary. If you are courageous enough, if you can see the patterns, if you can diagnose, observe what is happening, it is in your power to break that pattern and break that cycle, break that chain of mental health illnesses in your family. Pre-birth environmental exposures. It's not it's bad when we say that a pregnant woman should be given a positive environment. She should not. It's because of this, because whatever she is feeling, whatever she is going through, whatever she is seeing, it directly impacts the brain of the developing child. It is proven to be true. Brain chemistry, again, sometimes the neurons and the chemicals that are present in our brain, they lose their balance, and that too can cause some issues with your mental health. Trauma is a very defined, it's a broad defined term, and it's like can be physical, it can be psychological, anything that impacts your way of thinking, it's going to cause issues. Stressful life situations. Everyone experiences stress once in a while. Maybe some people experience it daily. But again, it depends how you handle stress. And sometimes there are too much for some people to handle that causes health issues. Ongoing chronic medical condition. Yes, sometimes there are physical diseases, physical illnesses that can impact your mental health because they tend to hinder your way of normal living. And I personally feel that if someone is asthmatic or a diabetic, they tend to get depressed because for an asthmatic, he can't indulge in rigorous physical exercise, and diabetic can't indulge in the sweet desserts that we have. So I feel bad for them sometimes, but this is life. There are some people who are diabetic and who are asthmatic, and they move around their lives very well. So hats off to them, salutes to them. Childhood history of abuse or neglect. Unfortunately, it is a sad thing in our society that we tend to ignore children like, oh, they are children, just forget it, they don't understand, just leave it. They'll grow over, they grow out of it. It's not true. Children, they are bad at verbal expression. They don't know how to express what they are feeling, what they want. But they have eyes, they see, they have ears, they hear, and whatever they see, whatever they hear, it gets absorbed in them. They understand everything. The only problem with them is that they don't know how to express it. And when they are old enough to express, it ends up like some mental health issues, which then the parents or adults, they don't understand what is actually causing it, but they themselves have been the cause, and it is just the reaction that the child is showing. Drugs. Some medication can, when used inappropriately, can be issues, and of course the addictive drugs like heroin and cocaine, etc., they are also very much linked with mental health issues. Symptoms, again, they are broad ranged, and many people show them with various other things, so they're not, these symptoms are general, so don't consider them that like if you have all these or some of these, you have some mental health issue. Sadness, we all feel sad, so nothing new in here. Confused thinking. This is, again, I'm going to just discuss highlight them briefly here, because on their own they are uh, detailed talks in them. Difficulty concentrating. Now, this is something which people don't understand, and they tend to take it like because it's some difficult task that's at their hand, but it's like the mind is so busy elsewhere that they are not able to focus on the task at hand. Excessive fears and worries. Again, everyone fear, being fearsome and being worried, it's normal, but there is some limit to it, and everyone has a different limit. Extreme feelings of guilt. Things go wrong in everyone's life, but being guilty of what has gone wrong in even in others' lives, and you were there somehow, and taking that guilt, and that's a warning sign. Sudden and extreme mood changes. Again, everyone has mood changes, mood swings, but sudden and extreme and unexplained, uncalled for, this is a system of the mental health issue. Withdrawal from social life. Every once in a while, we tend to sit back, enjoy our own company, but leaving social life altogether and withdrawing from it, and if there is someone you know, go ask if they are okay. Fatigue. Fatigue after some physical exercise or from a lot of writing or excuse me, some other mental work is understandable, but fatigue, even if you have not done any much work, it's another sign that there is some issue with your mental health. Delusions, paranoia, or hallucinations. Yes, this is some symptoms which need to be looked into seriously, and not just say, oh, it's okay, it happens with everyone. It does not happen with everyone. Reduced ability to understand and relate to situations and people. When you are involved with your mental health issue and you are so concerned about yourself, whatever is going on in your head, you tend to ignore what is going on around you. You are in your own state of mind and you don't understand what the other people are going through or what the situation really is. This again goes to delusions or hallucinations, so it's sort of interrelated, but these need to be looked into. Changes in eating habits. Some people say that, oh, it happens normally, maybe, but I think that if someone is eating too much suddenly, or if someone is just refusing food, they need to go see a doctor if it's not other physical and underlying health issue. And if it's not that, then there's something going on with their mind. Hostility, violence, and anger. Again, this is something which is not very normal, and if this is continuing, that there is some concerns. Suicidal thoughts. Now, this is the last thing, and everyone does not feel suicidal, and even thinking about suicide is something that should ring an alarm that something is wrong. Mental health issue has some physical symptoms. Stomach pain, which include and not just limited to stomach pain, headache, back pain, stiffness in neck, unexplained body aches and pains, stomach ulcer, high blood pressure. These things are, again, it's not only limited to the mental health, and these are not the only physical symptoms. Maybe every person has a different body, like they have a different mind, so they react differently to their problems. And if these physical symptoms occur, it's better to get them checked for any other underlying medical condition. But as it says that like unexplained body aches, if everything comes out clear on the medical front, on the physical front, then I think the doctors or the patient, him or herself, or the parent, the caretakers, they look into it like maybe there's something else that is going on inside in the mind that is causing this problem. Identification. Yes, How to identify that if it's a mental health concern? Again, symptoms are different for everyone, so identification is possible. But I would like to suggest that don't diagnose that someone is having some issues with the mental health. Just find out, see if things change, if things improve, well and good. If not, don't diagnose and don't label that person with that, like, hey, that person has a mental health problem or mental health illness. Increased enjoyment of life. I've, as said, like, so withdrawal from social life, same thing. Family conflicts. If a family is having conflicts, maybe one or two people there, they have some mental health concerns which are not being looked into. Difficulty in maintaining relationships. Everyone who is busy in forming a relationship with themselves, with their mind, they're going to have some difficulty with making relationships with others. Social isolation. Again, decreased enjoyment of life and social isolation as go hand in hand. Problems at work or school. If they're working and they're going to school, problems tend to emerge. Their work don't get finished, they are not attentive, they have some fights, anger issues, anything. Financial issues, and because they will not be attentive mind with mentally, their finances can go here upside down and some problems can occur. People who tend to self-harm or harm others, again, it's not natural, it's not normal, and it needs to be looked into. Inability to express emotion. Some people say that we don't express, we are very bad at expression. Being bad at expression is different thing, and unable to express emotion is a totally different thing, and I believe it is again something abnormal. Low resistance to common infections. As we did discuss this in our previous mental health matters talk, that when the mind is ill, it's not healthy, our defense system, our immune system, it is more focused on catering to that concern. Hence, the common infections, they are very they are when we don't have resistance to our physical diseases and infections. So if someone is getting cold or flu every now and then, and they are not resisting see weather changes, which they used to do, again, you have to look into it. Heart diseases, yes, stress can cause issues with the heart, like high blood pressure is also a heart disease, I would say. Misuse of drugs. If someone is using medication and they misuse it, it's an mood swings. Again, if they are unexplained, uncalled for, it's a, and the bottom line is that all these symptoms that and the identification that these things, they last longer than 2 weeks. Once in a while, it's okay, but if this becomes a habit, or these things continue for more than 2 weeks, this is another alarming situation. It's an alarm that help should be sought for. The types of mental illness, there are many, and I'm going to just briefly go through them so we can have an idea what we are dealing with. And the symptoms of some mental illness, they overlap, and it's only the professional's job to diagnose what actually the problem is. So I will not go into the details of them. Neurodevelopmental disorders, they include autism and ADHD. ADHD is okay, attention deficit hyperactivity disorder. Someone who, it's mostly found in children, but adults come up with it as well. Psychotic disorders, schizophrenia and paraphrenia. Sleep disorders. In sleep disorders, you either have trouble sleeping, or if you're asleep, you can't stay asleep. You end up waking every now and then. Bipolar and related disorders, it concerned with your personality. Depressive disorders, anxiety disorders, obsessive compulsive and related disorders. Obsessive compulsive disorder is most commonly talked about OCD, if you have heard. Many people say, oh, we have OCD, and they're very proud of it. But come to think of it, OCD makes life difficult for the patient and the people who live with that person with OCD. It's okay to try to achieve perfectionism, but be realistic, people. We are human beings. We can't be perfect. Not or anything around us can be perfect. Trauma and stress related disorders, PTA, post traumatic stress disorder. This is the most common one we know of. Dissociative disorders, feeding and eating disorders. Yes, changing in eating habits, this is a disorder. Elimination disorders, gender dysphoria, addictive disorders. Now, there are some things that trigger a mental health issue. Sometimes people have a good resistance, good tolerance, but people who have a underlying mental health issue, even small things trigger that and makes it difficult for them to react normally, and their symptoms they multiply. Severe emotional, physical, or sexual abuse. Even seeing such a thing or hearing such a thing can trigger it. Of course, experiencing it can be very problematic. Major loss in life. Major loss in life, it can be a death of a spouse, or losing a parent, losing a child, or if getting a divorce. It can be for the children, like divorce, and can be for, it's equally triggering for the children as well. Comparison with others in similar role. This is what adults usually do with children. I've observed, like even in schools, teachers like, oh look, if that class fellow can do it, why can't you do it? Parents at home end up comparing the cousins or the siblings, like if he can do it, why can't you do it? For children, even for adults in office and professional life, if you are being constantly being compared with others, it can send you into a mental illness scenario. Negative environment that you live in has a great impact on your mental health. And when people say that avoid social media, I think that means that, and personally I think social media is source of a negative environment, because everything there is so perfect that we think that not perfectionism can be achieved, and it is not possible. It is impossible. So that tends to send a negative impact to us when we see like, oh, our room is not decorated properly, it has this flaw, or we don't know how to dress. Anything we compare ourselves with in our environment. And again, on the news channels, all the negative news, like this happened, this was killed, and I don't want to go into them, but they tend to give out negative vibes and we absorb, and then again our mental health is impacted. Non-understanding people. Yes, people don't understand what we are going through. If you are going to discuss your problem, most people end up saying, oh, it happens with everyone, it's okay, you'll grow over it. No, it tends to make life difficult for the person who is there to seek help. Neglect. Again, it's because what the non-understanding people do, they don't listen to you in the first place. They overlook you, they ignore you. Violence. If anyone is just getting violent suddenly and they see violence, it can trigger the issues. Sedentary lifestyle. If you're sitting all the time, yes, it can impact your mental health. I mean, I just found this image and it was so, I found it interesting. Like, this is this man, and he says, like, my doctor insists that I keep moving. He has a desk job. So, and he's not concerned, like, does driving a car count? He's moving in the car, but sitting. What about picking up the remote control? This is some move activity. And then he's like, all this activity has made me tired. So if you're similar to this person, I think you need to change your lifestyle. Genetics, again, if there is some in your family who has some mental health issues, you are in, you should be on a watch for what is going to happen with you. Stressful life situations, if there is some underlying health issue, stress can trigger it. Mess, a messy room or a messy cupboard or a messy kitchen, yes, they do cause some mental health issue. And again, it's going to be a detailed discussion about how mess can be triggering, but it is at times, because when the mind is messed up, the physical environment, if it is messy, it adds to that stress and pressure of mental illness. Okay, now the main topic, what to do to help others. If you see someone around you, the best thing you can do is acknowledge that they are in trouble and they need help. And here I would also say, like, show empathy to them. Observe what triggers, what are the symptoms, try to identify how you can assist if it's possible. Listen to them. That's the most important thing that you can do. If someone comes to you to talk about their problem, listen to them. Assist. Again, don't bombard them with suggestions, or don't bombard them like, oh, with examples that this happened with that person as well, or she was in the same situation. No, just listen to them first, and before suggesting anything or even offering help, do ask, like, do you need any, do you want me to help? If they say yes, please do. If they don't, if they refuse, acknowledge that as well. Honor them. Open and honest discussion. Be very open about it. If you feel that someone in your premises or in your circle is having some concerns, discuss it openly with them. Don't give them like, hey, do you have some mental health issue? No. Be gentle, be polite, ask them properly so they open up easily, and don't be judgmental. Break the pattern. If you can observe the pattern, the things that trigger them, and it is in your power, try to break the pattern for them, make life easy for them. Arrange for professional help. Again, if they ask for and they are ready to go for professional help, nothing is going to work if they resist treatment. What to do to help yourself? If by listening to this you feel that you have some underlying mental health issue, there you can help yourself as well. How? Acknowledge. Yes, the best thing that you can do is acknowledge that yes, there is something wrong with you. I'm not saying that being sad or being angry is abnormal. Every now and then it's very normal, it's very natural. But the bottom line is, if you are being angry at petty things for more than 2 weeks, it needs to be looked into. So acknowledge it. You are not your illness. If, God forbid, something is wrong with you, it does not define you. You are not your illness. Seek professional assistance. Again, if you have someone you can talk to, or if you have some privacy issues or secrecy issues, go for professional assistance. There are many psychologists. We can connect you with them as well, and you can message us privately, and we'll look into it and arrange for you a psychologist for you, not a psychiatrist, for a psychologist. Right. You can write your concerns. I mean, some people write I would say like journaling or writing, whatever it is. I mean, just write it out, even type it, but just let out whatever is bothering you, is causing you problems. Take care of yourself. Yes. I mean, take a bath, change clothes, get out of your sleeping suit, comb your hair, and yes, that is going to help you a lot. Exercise again, keep moving, change your sedentary lifestyle, avoid self doubt and shame. As I said earlier, you are not your endless. So if something is bothering you, don't label yourself, don't go into doubt, talk about it, discuss it. Help is always there. Do not isolate yourself. Help is not going to come on its own. You have to go out, and isolating yourself can be fatal. Join a support group. I'm not very knowledgeable about support groups in Lahore, but there might be some, and we can arrange for it as well. I'll post about it later on the page, inshallah. Takeaway note for this uh, mental health issues talk. It's by Russell Wilson. If we start being honest about our pain, our anger, and our shortcomings, instead of pretending they don't exist, maybe we will leave the world a better place than we found it. It is something that we usually do. Not all of us, most people do that. They ignore things, or they just say, oh, it's a passing moment, we'll grow out of it. No, we don't. Sometimes we, yes, sometimes we don't. And another thing that I would like you to focus on is, if you know your triggers, tend to them with love. Be show empathy to them. And these were the references that were primarily used for all this data. If you want, I can share the links on the page as well, and do let me know. And thank you for joining us. I hope you enjoyed the session today and you did learn something from it. And do share the feedback and let us know what else you would like to know about mental health. And see you around. Take care. Enjoy the day. Allah Hafiz.